Welcome to Science Force. Tuberculosis, a disease that silently spreads through the air, affecting millions of people worldwide. What makes it even more dangerous is that it can live inside the body without showing any symptoms for years. In this video, we will explore tuberculosis in detail, how it spreads, how it affects the body, and how the Mantoux test helps detect it early. What is TB? Tuberculosis, commonly known as TB, is a chronic infectious disease caused by a bacterium called Mycobacterium tuberculosis. It primarily affects the lungs but can also spread to other parts of the body. Organs affected. Although the lungs are the most commonly affected organ, TB can also involve the brain, bones, kidneys, and lymph nodes, leading to serious complications. Bacterial characteristics. This bacterium is rod-shaped and slow-growing. It has a thick, waxy cell wall that protects it from harsh environments and makes it resistant to many disinfectants. Transmission. Tuberculosis spreads through the air. When an infected person coughs, sneezes, or even talks, tiny droplets containing bacteria are released into the air. Not spread. It's important to understand that TB does not spread through touching, sharing food, or casual contact. Entry into lungs. When these infected droplets are inhaled, the bacteria travel deep into the lungs and reach the alveoli, the tiny air sacs responsible for gas exchange. Immune response. At this stage, immune cells called macrophages try to engulf and destroy the bacteria. However, TB bacteria are capable of surviving inside these cells. Granuloma formation. To control the infection, the body forms a protective structure known as a granuloma which walls off the bacteria. Latent versus active. This leads to two possible outcomes. In latent TB, the bacteria remain inactive. In active TB, the bacteria multiply and cause disease. Symptoms. Active tuberculosis presents with symptoms such as persistent cough, chest pain, coughing up blood, fever, night sweats, weight loss, and fatigue. Extrapulmonary TB. In some cases, TB spreads beyond the lungs, affecting organs like the brain, bones, and lymph nodes. Diagnosis. To diagnose TB, doctors use multiple methods including chest X-rays, sputum analysis, molecular tests, and the Mantoux skin test. Mantoux test. The Mantoux test is a simple and widely used method to detect latent tuberculosis infection. PPD. It uses a substance called purified protein derivative or PPD which contains TB antigens. Injection. A small amount of PPD is injected into the skin of the forearm using an intradermal technique. Waiting. The injection site is then observed after 48 to 72 hours. Induration. What doctors look for is not redness but a raised, hardened swelling known as induration. Interpretation. The size of the induration determines whether the test is positive or negative depending on the individual's risk factors. Positive meaning. A positive Mantoux test indicates that the person has been exposed to TB bacteria, but it does not confirm active disease. False positive and false negative results. False positive and false negative results can occur due to vaccination, immune status, or recent infection. Drug mechanism. Treating tuberculosis requires a combination of antibiotics taken over several months. These drugs are classified into two types, bactericidal and bacteriostatic. Bactericidal drugs directly kill bacteria, leading to their destruction. Cell wall destruction. Some of these drugs break down the bacterial wall, causing the bacteria to burst and die. Metabolism block. Others interfere with essential metabolic processes, preventing the bacteria from producing energy. Key drugs. Important bactericidal drugs include isoniazid, rifampicin, and pyrazinamide. Isoniazid inhibits the synthesis of mycolic acid, weakening the bacterial wall. Rifampicin blocks RNA synthesis by inhibiting bacterial RNA polymerase, stopping protein production. Pyrazinamide works in acidic environments inside immune cells, targeting hidden bacteria. Bacteriostatic. Bacteriostatic drugs do not kill bacteria directly, instead they stop their growth. Protein synthesis. They often work by inhibiting protein synthesis, preventing bacterial multiplication. Ethambutol. Ethambutol is an important bacteriostatic drug used in TB treatment. Mechanism. It interferes with cell wall formation, weakening the bacteria and stopping their growth. Comparison. Bactericidal drugs kill bacteria, while bacteriostatic halt their growth. Both are essential for effective treatment. Combination therapy. Using multiple drugs ensures that bacteria are attacked in different ways and prevents resistance. Resistance. If treatment is not completed, drug-resistant TB can develop, making the disease much harder to treat. Prevention. Tuberculosis can be prevented through vaccination, early detection, and proper treatment. In summary, tuberculosis is a serious but treatable disease. Early detection through the Mantoux test and proper drug therapy are key to controlling its spread.
Thank you for watching Science Force.